context, we've called you all here to talk about a revolutionary new therapy. And before I speak about it, I thought a short presentation will take you through where we stand with it today. Can I have the PowerPoint presentation, please? The heart. It controls the flow of blood in one direction. So the good blood from the lungs comes to the left upper chamber of the heart, and that flows through the mitral valve, and then the bottom chamber pumps it to the entire body. We have several other valves in the heart, namely 4. Statistics have shown that mitral valve disease is at least 2 to 3 times more than aortic valve disease. The aortic valve is the second valve that we've all discussed with all you members of the press, where we talk about TAVI and TAVR. Even in a country like America, in 1 year, 4 million cases of mitral regurgitation are diagnosed, and only 1.5% of them are treated. So it's safe to assume that in India, we at least have 4 million cases of mitral regurgitation every year. Now, this is a nice animation that helps you understand. If you look at, I wish my pointer would work, but I'm going to make do. So if you look at that valve, that is the mitral valve. And the blood normally flows from above downward. But if something goes wrong and the support of the valve tears off like that, blood starts going backward. Now what happens when blood goes backward in the heart? 2 things. Since not enough blood is going forward, the patients get very tired. They can hardly walk. The remaining organs of the body, like the brain, the liver, the kidney, don't get enough blood, produce extreme fatigue. Now simultaneously, a large volume of this blood is going backward. And where does it go back to? If it doesn't go to the body, it goes back to the lungs. So this will flood the lungs with fluid and make the person feel that he is drowning in his own secretions. So this is what happens. So they feel uncomfortable, they can't breathe. The MitraClip is a tiny clip that is actually introduced into the body through the leg, and it is used to clip the mitral valve leaflets together. If you looked at the previous video, you remember seeing the valve that was all flopping around it. And look at this video. You can see the tube going up. It's entering the heart. And it looks over the valve from above. So this is the tube in which the MitraClip is introduced. And then the clip moves in. It's bent into position. It's actually opened out like a tiny little clothes slip. Moved under the valve, exactly where the leak is the most. And just pulled up, and the leaflets are clipped together, thereby getting rid of the leak, and the patient improves dramatically. So the important thing is it's a mechanical solution to a mechanical problem. That is why the improvement is so dramatic. Presentation. So I don't know if you all remember, we were here just 3 years ago when we did one of India's first few patients. She was very sick, and her only interest was that she wanted to get back to playing badminton with her grandchildren. And all of you covered extensively how just 3 days after the procedure, she came here and played badminton with her grandchildren, and she was quite good at it. So that was how we started our journey. Now, during this last 3 to 4 months, which have been extenuating for all of us, for all of you from the press, for all your families, and for all of us doctors as well, because COVID has been raging a never-ending onslaught on us through the second wave. Now, even during these worst few months, we were able to take care of several really sick patients who flew in with severe heart failure. Now, this was an 86-year-old gentleman, diabetic and hypertensive, who had a massive heart attack, had emergency stenting. Because the heart attack, depending on which blood vessel it affects, it can affect the mitral valve. So if it is the blood vessel supplying the mitral valve, that area dies off, and the mitral valve doesn't work well. He developed a severe leak of the mitral valve. They could not remove the ventilator. They could not remove the balloon pump. And at this point of time, his BP was 80 systolic. and the family shifted him by ambulance to our hospital. Can you see that bright blue color on top? That bright blue color on top is the blood going back up. That is what is called mitral regurgitation. So, and you can see the clip arms open in the second picture there. And then, look at this, you can see the clip arms. And you can see how the clip catches the two leaflets. And then the clip is released in place. And look at this, the severe leak on the left and no leak at all on the right. So just imagine, the patient comes in because of the severe leak, blood going backward, filling his lungs, unable to maintain pressure. The minute you clip him, there's no leak. Within hours he improves. This is the pressure inside the heart before the procedure, that is after the procedure. This is him 12 hours post-procedure, and after 1 week of being in a venue with his great-grandchild, just 1 week later. This is how incredible this therapy is. 72-year-old heart attack in 2005, very poor heart function, severe heart failure on multiple medications. He too was advised a heart transplant. But as COVID was raging, hearts were rare, supply chains were broken, patient became sicker and sicker, mitral leak increased. They could not maintain him on medication anymore. So the family decided that they would come to Apollo. They called an air ambulance. The first air ambulance refused to take him, saying he was too sick. So the family spoke to me. I said, don't worry, let's wait for a second one. They managed to pull a few strings, get on a second air ambulance, and by the time he reached us, his kidney was shutting down, his liver was shutting down, and his entire body was starving of blood. I know how I can see, and you might find it difficult to see, so you'll just have to take my word for it, that the heart was really dilated and there was not much function. Can you see the bright blue jets on top? By now, I've explained that these bright blue jets are the leak that's going up instead of coming downward into the heart. So that is the 3D echo, where we looked at the heart, we went ahead, we clipped it. After one clip, we realized that the leak had got better, the patient was behaving better. Literally a crashing patient who had come in by air ambulance, suddenly the blood pressures were better. So decided that let's do everything we can, put a second clip right next to the first. That big hole is not supposed to be there. And once the two clips are placed, you can see it beautifully when the valve is closing, you can see a beautiful line of the valve closing. It's become two holes. This huge leak becomes nothing. The high pressures became nothing. And this is something that cardiac anesthetists use. It's called blood gas analysis, which shows how much blood is going to the rest of the body and how sick the patient is. So you can see a lactate of 9.6 is down to 1.3. And look at the monitor. Now blood pressure is 130/70, saturation is 100, heart rate is 69. Even if you look at my hospital chart, I took the liberty of bringing this. You can see the kidney function from 2.5 has gone all the way down to normal. Liver enzymes went back to normal. This is him just 12 hours post-procedure, and that is him 36 hours post-procedure. And now, for the reason why we have really called all of you here. I know that you've seen some really tough cases that we managed to do during the peak of the pandemic here. And we were extremely blessed to get all these cases in and out of hospital without any problem, even during COVID, because of a very, very efficient bio bubble that separated all these patients. Now, when you talk about comorbidities, you can't get patients sicker than these. But we still managed to get all of them in and all of them out of hospital because of the infection control protocols we have. But none of these cases, while they're all special to me, are as remarkable as the patient I called you for here today. A 41-year-old farmer was doing extremely well. I am sorry I'm talking about Kameshwar in third person, who's sitting right here with us. But a 41-year-old farmer who was doing extremely well until early of this year, suddenly became short of breath and went to a hospital in Vijayawada. When they examined him, they said that his heart was very weak and he had to rest, and they sent him home. He repeatedly kept getting sick until he could not be managed at home and had to be hospitalized. After spending 1 month in hospitals in Vijayawada, they shifted him to Hyderabad for better care. Even in Hyderabad, they said the heart function had come down very badly. It was only 15%, and that he needed to be on a heart transplant list. While he was waiting for his heart failure became so bad that they could not maintain his blood pressure. And as a last desperate attempt, the family flew down to Chennai. His heart muscle was so weak that even before we accepted him, we were not sure that we could help him. But the family said, all we want you to do is try. All we want to know is that we did everything possible to make him all right. So we went ahead. About 5 days back, we performed the MitraClip on him. In just 5 days, he's gotten off the ventilator, which was almost a day after the procedure. In just 5 days, he's able to sit up. He's able to walk here without a wheelchair so that he can be present among all of you. And his heart function has gone from 15% to 30%. Now I am hopeful that with careful medical attention, he might even not require a heart transplant. Now the reason why we had a detailed discussion with our surgeons and the remaining groups of doctors and decided to do the therapy is that it was a compassionate process. We just wanted to do a bridge to heart transplant. We thought that medication is not holding him, we'll just clip him so he becomes a little stable till he receives the heart. Even we were pleasantly surprised as to how well he's improved. So he's here. With this, I say thank you so much and hand it over to the MC.
For us, because in healthcare we're actually in the business of caring and saving lives. And for us the success is the patient's trust and the patients who get well and go home to a normal life. And as a pioneering organization, I think Apollo has consistently and with focus done only this and nothing else. And for us, this is really the DNA of our existence. And such efforts would not have been possible unless we had champions like Dr. Sai Satish, who keeps pushing the boundaries of medicine and who keeps pushing the boundaries of what the responsibility of giving back to patients are. And for that, we're thankful that the organization can support a doctor's vision, a clinical vision, and bring the best in class which is available globally to our country, and set the standards for better outcomes, set the goalpost much further away so that we can continue to do more. And more than anything else, become part of a global network where research, innovation and technology becomes the mainstay of an organization. And I think that is why Apollo is probably the greatest place to be in, whether it's for people like all of us who work there, or for people like the patients who come there with a lot of hope and trust. So for the members of the media, thank you so much for being with us today. We have many milestones at Apollo and we're always sharing that with you, not because we want to say we're the greatest and the best, but because we want to say that such things are possible in our country and we're proud to be Indians because it truly sets India on a global platform. We were the first in Asia to perform 4 MitraClip procedures in a day, and you were all part of that story. And we've surpassed Japan, where only 3 MitraClip procedures were performed in a day. So, we already set the standards so high. We also have taken a leadership position with over 70% of the MitraClips in India being performed at the Apollo hospitals and in Chennai. So, நம்ம சென்னையில இருந்து இவ்வளோ நல்லா பண்றோம்னா மற்றவங்களுக்கு தெரியணும், கண்ட்ரிக்கு எல்லாம் தெரியணும், and the rest of the world has to know that Chennai is a great place to be in for medical work, medical technology, and of course for healthcare tourism, because the other people should come to Chennai for that. So for that, I'm truly proud. Over the past 15 months, COVID has been the biggest concern, not only in India but all over the world. But Apollo has been at the forefront we can to help during the crisis, whether it's treating patients with the best protocols which are available worldwide, getting the best medications which are again sometimes not available in our country but importing them for people who need it, setting vaccination programs in such a way that we're actually the largest vaccinators in the private sector. But while we are doing this on one side, during the COVID crisis, people are afraid to come to a hospital, and the clinicians are also afraid because they're human beings after all, but never in a hospital like ours. And during the COVID crisis, for us to be able to achieve these kind of numbers of life-saving procedures, because you understood and you saw that if we did not intervene at this time, if doctors like Sai Satish did not go into the cath lab and do what they had to do, then lives could have been lost. So I think that is the kind of credit which the clinicians of Apollo should be getting. Again, for all of us who are here, India is home to 25% of the world's coronary heart disease, and that is a huge burden. And 120 million hypertensives and a large number of individuals with rheumatic heart disease. So unless we find ways to intervene and unless we find ways to help all these people, I don't think we will be doing our duty as healthcare providers. And that is why Apollo calls and invites, every time we do something like this, all of you to be part of the story, part of the journey. Because unless we communicate and let people know that these options are available to them, we would not be doing work as responsible citizens. And we look and we lead to save lives. And while we are doing that, I think we want you to be part of that journey. And that is why we're meeting here today, to celebrate lives, to celebrate a life of patients like who you will be seeing. And also to celebrate the fact that we can actually achieve things when we set out to do it. So thank you all for being with us today. Thank you, Dr. Sai Satish and your team for delivering consistently on the highest levels and the highest standards of care. And let me assure you that the organization will always be there in this journey, because we don't do it for ourselves. We do it for the people who come to us with so much of hope and trust. Thank you, Namaste and Jai Hind.
Can I have a chair, please? Now, Doctor? Very good. Can I request our Vice Chair also to join us on the stage, please? Ma'am? Actually, முதல்ல கொஞ்சம் நின்று பேசிட்டு இருந்தேன். ஏன்னா எனக்கே நம்ம சென்னையில நின்று இங்கிலீஷ்ல ஃபுல்லா பேசுறது எனக்கே ஒரு மாதிரியா இருந்துச்சு. ஸோ இப்போ நான் ஒரு குயிக்கா தமிழ்ல விளக்கிடுறேன், சரிங்களா? இவர் ஆக்சுவலா ஆந்திரால இருந்து சிவியர் ஹார்ட் ஃபெயிலியரோட 90 நாள் ஹாஸ்பிட்டல் இருந்து ஹாஸ்பிட்டல் வரைக்கும் போயிட்டு இருந்தாரு. விஜயவாடால ஒரு கிராமத்துல ஒரு விவசாயி, 2 சின்ன குழந்தைங்க, இவரோட 2 அண்ணங்க, மனைவி. கடைசியில விஜயவாடால எதுவுமே பண்ண முடியாதுன்னு சொல்லி ஹைதராபாத் போனாங்க. ஹைதராபாத்லயும் ஹார்ட் ரொம்ப வீக் ஆயிடுச்சு, உன்னால எதுவுமே பண்ண முடியாதுன்னு வெண்டிலேட்டர்ல போட்டு எடுத்து கடைசியில லாஸ்ட் ரிசார்ட் இறுதியும் டைமும் கிடைக்கல. அந்த டைம்ல இவரு நீரேகடா அவரை பேச விட்டா பேசுவாரு, ஆனா தெலுங்குல பேசுவாரு. தெலுங்குல பேசுவா நானே டிரான்ஸ்லேட் பண்ணிட்டுமா? Sure. You want me to finish this up quickly and then do Q&A?
No,
Whatever you say. Q&A. Any questions? So, you can have Tamil English? English? Okay. So, you can have several reasons why this mitral valve can leak. One, you can have your mitral valve leaking because the valve gets damaged. And that is because of, like ma'am had mentioned, rheumatic heart disease, which is quite prevalent in India. Two, you can have these valves get damaged because you're born with a floppy valve. Neenga kettupiga mitral valve prolapse. It's very common. These prolapse valves, when they are strained, the mitral valve is like 2 parachutes. Okay? You've seen the strings below the parachute, right? So these 2 parachutes open and then close and become like this. If the string breaks off, the parachute doesn't close and blood leaks. So this is congenital. That is, they're born like this, they degenerate quicker, they tear off. These are reasons that involve the valve. Then there are reasons that involve the heart, where your question comes into play. Patient has a heart attack. The heart doesn't squeeze. It gets damaged. It becomes thin. It becomes scarred. Once it becomes thin, it starts ballooning out. See, if it's thick and muscular, it stays tight. If it's thin and damaged, it balloons out. Now, as it balloons out, what happens to the valve? It starts enlarging. When the valve enlarges, the leaflets don't touch. And then you have the leak. So he had a bit of both. He had a tear in the valve leaflet. Because it was ignored over a long time, the tear enlarged the hand. The heart, as it enlarged, the leak increased. So it is a vicious cycle. The leak enlarged the heart, the enlarged heart increased the leak, until he got very sick. Now, initially when we attempted him, it was just a bridge to fix him till he gets a heart. But by God's grace, looking at how well he's improved, it's only 5 days since he has spent 90 days in hospitals and ventilators, and he's able to walk to us. Right? So that is how incredible this therapy is. He came to us with a heart function of 15%, and I had kept him in hospital because I want to discharge him tomorrow, because today might be a strain. He was all excited to come here. He woke up at 5 o'clock. I told him, why did he wake up at 5 o'clock? So he said, I couldn't sleep. We didn't want to bring our other 80, 85-year-olds because whatever said and done, it's COVID time. But he said, no, I want to come. And I think this is the kind of confidence that he also needs to go back home to know that I'm all right. To answer your question on his heart function was 15% when we started. Today it's only 33%. It's only 5 days. So I'm very hopeful that he will get off the transplants. So, ஆக்சுவலாக வந்து எத்தனையோ சிக் கேசஸ் பண்ணியிருக்கோம், நீங்களே பார்த்துருக்கீங்க. இன்னொரு பேஷண்ட் ஹார்ட் டிரான்ஸ்பிளான்ட் அவாய்ட் பண்ணியிருக்கோம். பட் என்ன இருந்தாலும் இவர் வந்து எனக்கு ரொம்ப ஸ்பெஷல் கேஸ் மனசுக்கு. ஏன்னா 41 வயசு, 2 சின்ன பசங்க, ஒண்ணுமே பண்ண முடியாத ஹார்ட் டிரான்ஸ்பிளான்ட், கோவிட். இந்த நேரத்தில் எப்படியோ வந்து அவங்க தைரியமா வந்து இங்க கூட்டிட்டு வந்துட்டாங்க. கூட்டிட்டு வந்துட்டு நாங்க பண்ண உடனே இவரோட இம்ப்ரூவ்மெண்ட், இவரோட சிரிப்பை பார்த்தா என்னதான் கோவிட் இருந்தாலும் என்னதான் கஷ்டம் இருந்தாலும் இதுக்குதான் நம்ம ஹாஸ்பிட்டல் வரோம்னு எங்களுக்கு அந்த நம்பிக்கை, டாக்டர்ஸா எங்களுக்கு அந்த நம்பிக்கை வருது. ரெண்டாவது பாத்தீங்கன்னா எங்க ஹாஸ்பிட்டல் நீங்க நம்ப மாட்டீங்க, அப்போல 550 பெட் இருக்குங்க, ஆக்டிவ் பெட்ஸ். ஒரு டைம்ல பீக் ஆஃப் த கோவிட்ல நம்ம என்ன டிசைட் பண்ணோம், இந்த டைம்ல நம்ம மக்கள் கூட இல்லைன்னா எப்போ இருக்கு என்ன பிரயோஜனம், எல்லா கேஸும் எடுக்க ஆரம்பிச்சிட்டோம். தலையை திரும்பினா கோவிட் கேஸ். ஆனா கூட அந்த நேரத்துல இந்த மாதிரி 86, 87, 82 மல்டிபிள் கோமார்பிடிஸ், ஏர் ஆம்புலன்ஸ்ல வர பேஷண்ட் வந்து நீங்க நினைச்சு பாருங்க, அவங்க கோவிட் கேசஸ் வச்சு கஷ்டப்படுறப்ப நாங்க நான் கோவிட் கேஸ் இந்த டைம்ல வந்து ஹாஸ்பிட்டல்ல வச்சு MitraClip பண்ணி கோவிட் இல்லாம வீட்டுக்கு அனுப்பிடுவோம். ஸோ ஐ எம் எக்ஸ்ட்ரீம்லி ஹாப்பி தட் என்னோட என்வாயன்மெண்ட் கூட இந்த மாதிரி எனக்கு பண்ண வந்து ஒத்துழைக்குது. ஸோ அதுதான் ஒரு இன்னொரு இம்பார்ட்டன்ட் பாயிண்ட். That's it.
మాకు ప్రాణదానం చేసిన సాయి సతీష్ డాక్టర్ గారికి, ఇక్కడ వచ్చిన ప్రెస్ అందరికీ నా హృదయపూర్వక నమస్కారాలు. మాది ఆంధ్ర విజయవాడ దగ్గర ఒక చిన్న పల్లెటూరు.
ఒక్కొక్క నిమిషం నిలుపుకునే ప్రాంతాలు உங்களுக்கு வந்து மிகப்பெரிய வணக்கம்.
మా బ్రదర్ 40 years అగ్రికల్చర్ చేస్తూ ఉంటారు. సడన్గా ఏప్రిల్లో ఆయనకు నైట్ టైం కాఫ్ రావడం, పగలేమో మామూలుగానే అగ్రికల్చర్ చేస్తున్నారు, అంత బాగానే ఉంది. ఏదో చిన్న చిన్న అనుకుని మేము లంగ్ స్పెషలిస్ట్ దగ్గరికి అక్కడికి ఇక్కడ చూపించాం. ఈలోపు ఒకరోజు సివియర్గా నడవలేని పరిస్థితిలో ఉన్నప్పుడు విజయవాడ హాస్పిటల్కి వెళ్తే వాళ్ళు సివియర్ మైట్రల్ వాల్వ్ లీకేజ్ ఉంది, హార్ట్ ఫంక్షనింగ్ బాగా వీక్ అయిపోయింది, మీరు చాలా లేట్ అయ్యారు అని చెప్పారు. అక్కడ ఒక 1 week హాస్పిటల్లో ఉంచిన తర్వాత వాళ్ళు హైదరాబాద్కి షిఫ్ట్ చేశారు. హైదరాబాద్లో ఉన్నాము. వాళ్ళు వేరే అందరం ఫ్యామిలీ మొత్తం కూడా కొలాప్స్ అయిపోయి ఏ హోపు లేని టైంలో ఇంటర్నెట్లో డాక్టర్ సాయి సతీష్ గారి చిన్న ఎడిటోరియల్ చూశాను. నేను చూసి ఇమీడియట్గా సాయి సతీష్ గారిని కాంటాక్ట్ చేయగానే ఆయన దేవుళ్ళలాగా, ఓకేమ్మా కమ్ టు చెన్నై, ఐ విల్ సీ ఎవ్రీథింగ్, నేను ఇక్కడికి వస్తే సొంత తమ్ముళ్ళలాగా చూసుకుంటాను, వచ్చేయండి అని చెప్పారు.
it's a little embarrassing to translate, but what he says is that he had தமிழ சொல்லிடுறேன், ரொம்ப கஷ்டப்பட்டாரு, விஜயவாடாவில் ஒரு விவசாயி. ஆனால் ரொம்ப மூச்சு அடைச்சிருச்சு, அங்கே ஹாஸ்பிட்டல் போனால் வேலை ரொம்ப லீக் ஆகிடுச்சு, ரொம்ப லேட்டாக வந்துட்டீங்க, ஒன்றுமே பண்ண முடியாது, நீங்கள் கூட்டிகிட்டு போங்க, இங்கே எங்களால் எந்த ட்ரீட்மெண்ட் கொடுக்க முடியாதுன்னு சொல்லிட்டாங்க. அதுக்கப்புறம் ஹாஸ்பிட்டல் ஹைதராபாத் எடுத்துருக்காங்க, டிரான்ஸ்பிளான்ட் தான் பண்ணணும், ஐசியூ உள்ள வெளியில் வச்சுட்டு ஒன்றும் பண்ண முடியாது. அந்த டைமில் வந்து என்னோட இன்டர்வியூ பார்த்துட்டு என்னை கூப்பிட்டாங்க. நான் என்னோட தம்பி மாதிரி பார்த்துக்கிறேன், நீ வந்துடுச்சுன்னா எதுவும் யோசிக்காத, முதல்ல கூட்டிட்டு வா, டைம் வேஸ்ட் பண்ணாத. ஏன்னா ஒரு 40 வயசு பையனுக்கு இந்த மாதிரி ஹார்ட் ஃபெயிலியர் சொல்றப்ப நம்மளால எதுவுமே யோசிக்க முடியல. முதல்ல வந்துட்டு அதுக்கப்புறம் பார்த்துக்கலாம்னு சொன்னேன்.
డాక్టర్ గారు చెప్పిన వెంటనే మాకు ఎప్పుడు చెన్నై ఎప్పుడు రాలేదు లైఫ్లో, మాకు తెలియదు, డైరెక్ట్ గా బయలుదేరి వచ్చేసాం. రాగానే డాక్టర్ గారు హాల్లో ఎవరితో ఫోన్ మాట్లాడుతున్నారు. సార్ని వెళ్ళి విష్ చేయగానే దగ్గరికి వచ్చి, అమ్మా వచ్చేసారా, నీకేం పర్లేదు, నేనున్నాను, మీరు రండి అని లోపలికి తీసుకెళ్ళి చక్కగా మమ్మల్ని దేవుళ్ళలాగా ఆదరించి, నీకేం పర్లేదు నేను చూసుకుంటాను అని చెప్పి ధైర్యం చెప్పి ట్రీట్మెంట్ ఇచ్చి చక్కగా క్లిప్ చేసి బయటకు వచ్చి సక్సెస్ అయింది పర్ఫెక్ట్ గా, మీ వాడికి తిరగలేదని చెప్పారు. ఇంప్రూవ్మెంట్ కూడా బాగా అవుతుంది, వాడు 3 నెలల్లో లేచి నడుస్తాడు అని మాకు చెప్పగానే మాకు చాలా సంతోషం అనిపించింది. మా అమ్మ నాన్న ఆయనకి మొదటి జన్మ ఇస్తే డాక్టర్ సాయి గారు మాకు వాడికి పునర్జన్మ ఇచ్చారని ఎప్పటికీ మేము ఇంట్లో అందరం నమ్ముతున్నాము. ఇది ఎన్ని జన్మలెత్తినా డాక్టర్ సాయి గారి రుణం తీర్చుకోలేమని మీ అందరి ముందు పత్రికాముఖంగా నేను తెలియజేస్తున్నాను.
He's extremely grateful to all of us at Apollo Hospitals for what we have been able to help his brother with, and they're all very emotional. I think it is understandable.
అపోలో హాస్పిటల్కి రాగానే వీడు సేవ్ అవుతాడు అనే నమ్మకం మాకు కలిగింది. అక్కడ రాగానే అక్కడ విఘ్నేశ్వరుడికి రోజు దండం పెట్టుకునేవాళ్ళం. అపోలో హాస్పిటల్లో ఉన్నటువంటి విఘ్నేశ్వరుడికి ఇంత ప్రాణాలు సేవ్ చేసుకున్నటువంటి అపోలో హాస్పిటల్ వారికి కూడా మేము జన్మజన్మలా రుణపడి ఉంటామని మేడం గారికి కూడా తెలియజేసుకుంటున్నాను.
He says that when all hope was lost, he knew that if he comes and sets foot inside Apollo, he will have some hope, and his aspiration was not left for want, and he came in here and is walking out with his brother well, and his entire family and his life will always remain indebted to our hospital, and that's it. I think I should have had somebody else translate. It's very strange saying good things about us.
ఇంకో ముఖ్యమైన విషయం ఏంటంటే ఏ హాస్పిటల్లో కూడా మాకు దీనికి రెమెడీ ఉంది, మైట్రాక్లిప్ ఉంది, చెన్నై అపోలోకి వెళ్ళండి అని ఎవరూ రెఫర్ చేయలేదు. కేవలం సార్ ఇంటర్వ్యూ చూసి మాత్రమే మేము తెలుసుకోగలిగాము, ఎవరూ రెఫర్ చేయలేదు. అది ఇక సాయిబాబా మమ్మల్ని ఈ సాయి గారిని కలిసేటట్టుగా చేశాడని అనుకుంటున్నాము. ఇప్పటికీ కూడా ఈ సాయి గారికి జన్మజన్మలో ఆశపడతామని తెలియజేసుకుంటూ మాకు ఈ అవకాశం ఇచ్చిన మీ అందరికీ ధన్యవాదాలు తెలియజేసుకుంటూ సెలవు చేస్తున్నాం.
More people will realize that this amazing therapy can be a life-saving boon for people who have no hope. The beauty is people who are too high risk for surgery, 86, 82, 83, heart transplant, no heart function. If you choose the case correctly, the improvement can be like magic. And it is not one-man job. Today I'm just here representing my entire team who make us look so good. I'm absolutely no use without my anesthetist, without our echocardiographer, without my colleagues, without the entire heart failure team. So it is the entire atmosphere. Actually, it gets to a point where I joke saying that I'm of no use without the hospital that surrounds me. So thank you all so much.
We have few online questions, sir.
Sure.
This is a question from Biospectrum. What are the possible...
నేను హేమా మేడం కూడా చాలా థ్యాంక్స్ చెప్పాలి. కాల్ చేసిన వెంటనే హేమా మేడం మమ్మల్ని బాగా రెస్పాన్స్ అయ్యేవారు. ఎప్పుడు కాల్ చేసినా మీకేం ఇబ్బంది లేదు, మీరు వచ్చేసేయండి అని. హేమా మేడం, థ్యాంక్ యూ.
We'll convey this to Dr. Prema. Sure. So the question is, what are the possible complications with this procedure, post-procedure, and which are the contraindications for the procedure?
So, wow, such a technical question. I'm going to take this in English, please.
Sure, please.
Okay, good. The contraindications for this procedure will be, this procedure depends on the size of the left upper chamber of the heart. Now, I need a certain height to be able to take this clip, bend it, move it down and correctly clip the valve leaflets. This height is about 3.5 centimeters. Now you have to understand that we're doing all these movements in a 2 centimeter by 3 centimeter cube. That is the size of the left upper chamber. In that chamber, we are moving the clip, we are bending it, we are looking in 3-dimensional echo, making sure we're not touching the walls, going correctly over the leak and clipping. So if the chamber is small and the height is not enough, it's difficult to do. The next contraindication is infection. If the valve is infected, I can't put a clip. Because if I put a clip, the clip will get infected. So if the valve is infected, the only option is antibiotics, treat the infection, cut the valve out and put a new valve. Right? Even now in hospital, I have 4 patients who came for MitraClip, who we found had infection, who are settling down, who our excellent surgical team will be operating on. That's the second contraindication. The third contraindication is calcium. If the tip of the valve has been damaged for a long time and has bone-like deposits, then the clip won't hold it. So this is the third contraindication. The fourth contraindication is that if the valve area is supposed to be at least 4 centimeters square. In some people with small hearts, if it's small, then if I go put a clip, the valve area becomes even smaller. And I make a mitral leak, a mitral narrowing. So all these are very technical points and we have a detailed protocol. Every patient is assessed for each of these points and only the suitable ones are taken. Now, I'm almost scared to say this, but every single patient we have done over the last 3 years was in class 4 heart failure and until today hasn't had one heart failure related hospitalization. Every single patient who we have done in the last 3 years is well with their families till today. The oldest is 89, the youngest is this baby, 41. So we've been extremely fortunate and blessed. And the reason why we have this kind of outcome is because of the stringent screening for these cases. Our cardiac surgeons look at it, our cardiac anesthetists look at it, our echocardiologists look at it, clinical cardiologists look at it, I look at it, and when we all say yes, you will benefit, then we take it.
So any possible complications?
Same procedure. If you see, the clip was first used in human in 2003. It became first available commercially in Europe in 2013. It became first available commercially in the United States in 2018. And 1 year later, we at Apollo Chennai started giving this therapy to patients in 2019. More than 100,000 patients have been treated with the MitraClip till today, globally. And it has excellent safety profile because it is so recapturable, maneuverable, but there will be complications. And if there are complications, we have to deal with it. Okay, Kameshwar Rao. And I'm going to ask you all to bear with me and I'm not going to allow you to interact with him because like I said, he's too precious a baby for me. I've made sure that he stays far because of the COVID. I'm going to send him back as quickly as possible, but I'll be happy to take whatever questions you want regarding him.
One more question is from Kolkata media. So is this facility available across Pan India, Pan Apollo?
Not yet, but very soon it will be.
Sure, sir.
We always like to think Apollo is one family. If one hospital can do it, anybody can do it. It is imported. It's completely made outside India and it's imported en masse into India. So now that MitraClip is commercially available in India, even at Apollo now, I have stock for 9 clips. So there was a time in 2019 where I had to ask for clips and I'd wait for 2-3 weeks for the clips to come in. But we managed to speak with the drug company and said that since most of the patients are so sick, we want to stock the clips in our hospital, and since we do the most volume, we have clips on stock. So if the patient comes in with heart failure this evening, tomorrow morning I can clip it. There's no wait time. There's a big hole, right? And when the gap is wide, I need a bigger clip. The smaller clip is 15 millimeters, the bigger clip is 18 millimeters. Don't say, doctor, 3 millimeter clip. For a heart that size, for a valve that size, it matters.
What is the cost of this entire procedure?
The cost of the clip is around 25 lakh rupees. Okay? The cost of the procedure at Apollo Hospital is an average of 27 to 28. That's it. Because this is life-saving therapy for the Forsaken, the management has been extremely considerate in keeping the cost as low as possible to help as many people as possible. So majority goes to the clip cost, and the short amount, the remaining 2.5 to 3 lakhs, is because the patients all go home in 2 to 3 days. We are here, and every technology is now coming to India sooner and sooner. I started the clips in 2018. By early 2019, we did our first clip. So there is no lapse in technology or therapy between India and the rest of the world now. The gap has been closing rapidly, Mr. Dhananjaya, and I hope that there will be a time where India will get it first.
So why are people rushed to London or America? That was my question to the doctor of late Ramvilas Paswan.
I don't know if I'll fill the shoes of the doctor of late Dr. Ramvilas Paswan to answer that question appropriately, but I think a lot of us are still fascinated with the West. It might not be anything to do with the technical prowess, but you know, if you go to some of the best hospitals in the world, you'll be pleasantly surprised to see the leading valve repair surgeon in India. Cleveland Clinic, there's Raj Makkar. Belfast, there's Ganesh Manoharan. New York Presbyterian, there's Sushil Kodali. Names are all Indian, right? So we've done well for changing.
So your last word, we are really world class.
I'm just going to, yes ma'am.
Sai, you should tell every Indian to become Atmanirbhar. You know, it should not just be a word, it should be something we should be proud of and practice. Otherwise, just like the British and the Mughals and everyone took over India, somebody else will take it over. It's the right time to think about it.
I think that's said in a simple nutshell.
Thank you very much for the last word on heart solutions. That we are world class now, really.
Thank you, Mr. Dhananjaya. Thank you.
Okay.
Like ma'am so aptly put it, the reason we have you here is so that the rest of India knows that we are here at the helm and cutting edge of medical technology. Even under duress, we are performing cutting edge procedures on very sick patients and getting them home safe. We are adapting, times are tough, we are evolving, and we are trying to get better than we were. And all of you need to know that here in Chennai is where it's happening. Thank you all for coming here. हिंदी में कुछ बोलना यही हिंदी में चेन्नई में हिंदी में
I was showing you the patient Mr. Kameshwar Rao, who was a 41-year-old farmer who had severe heart failure, very low heart function of only 15%, was shifted from hospital to hospital, and he has been on ventilators and ICUs for over 90 days, for over 3 months, and finally came to us. When we looked at him, we found out that his heart muscle had still some reserve, and the mitral leak was so severe that it could be the major component that's making him sick. So after a detailed heart team discussion, we decided to use a new procedure called the MitraClip, even though he's 41, because the volumes were too big, no surgeon wanted to operate. He was not anywhere close to getting a heart for a transplant. So we thought if we clip his mitral valve, he will have a bridge, like some space before the heart transplant. But even within 5 days after the clip, his heart function from 15 has come to 35. He's able to walk and come after 90 days in hospitals and ICUs and ventilator. He was able to walk and come for the press meet today. So this is incredible therapy, and thank you all for coming here to cover this. வணக்கம் தேகந்துக்குள்ள வணக்கம். ஃபர்ஸ்ட் ஆஃப் ஆல் என்னோட பேர் டாக்டர் சாய் சதீஷ். நான் அப்போலோ ஹாஸ்பிட்டல்ஸில் இருக்கேன். ஆக்சுவலாக வந்து உங்களெல்லாம் இன்றைக்கி ஏன் இங்கே கூப்பிட்டாங்கன்னா, ஒரு மிக அதிசயமான கேஸ் நாங்கள் இப்போ பண்ணியிருக்கோம். ஒரு 41 வயசு விவசாயி. அவர் வந்து ஒரு இந்த வருஷம் பிறக்கிறப்போ அவருக்கு தெரிஞ்சிச்சு அவருக்கு வந்து சிவியர் ஹார்ட் டிஸ்ஃபங்க்ஷன் இருக்குது. இப்போ ஹாஸ்பிட்டலேருந்து ஹாஸ்பிட்டல் போயிட்டு இருந்தார். மாதத்துக்கு மாதம் மோசமாகிட்டு இருந்தார். சடனாக பார்த்தீங்கன்னா அந்த மைட்ரல் வேல்வ், அந்த ஹார்ட்குள்ளே இருக்கிற ஒரு முதல் வேல்வோட பேர் மைட்ரல் வேல்வ். இந்த லீக்கேஜ் ரொம்ப அதிகமாகிடுச்சு. இந்த லீக்கேஜ் மிக அதிகமானதுனால அந்த ஹார்ட் அப்படியே கம்ப்ளீட்டாக பலூன் மாதிரி ஊதி போய் இந்த ஊதுறதுனால லீக்கேஜ் இன்னும் அதிகமாகி ரொம்ப சிக்காயிட்டார். இந்த டைமில் வந்து ஒரு விஜயவாடாலேருந்து ஹைதராபாடு போய் நிறைய ஹாஸ்பிட்டல்ஸ் போயிட்டாரு. எல்லாமே சொல்லிட்டாங்க எதுவுமே பண்ண முடியாது, ரொம்ப லேட்டாக வந்துட்டீங்க, உங்களுக்கு ஹார்ட்டை டிரான்ஸ்பிளான்ட் தான் பண்ணணும். பட் ஹார்ட் டிரான்ஸ்பிளான்ட் பண்ணோம்னா ரெடியாக ஹார்ட்டும் கிடைக்கல, ரெண்டாவது ஐசியூவில் அவளை வைக்கவும் முடியல, ஏன்னா ரொம்ப ரொம்ப சிக்காயிட்டாரு. நிறைய மருந்து கொடுத்து வென்டிலேட்டர் கொடுத்து கூட பிபி தாங்கலை. இந்த நேரத்தில் அவங்க வந்து நம்மளை பற்றி கேள்விப்பட்டு இங்கே நேராக அப்போலோ ஹாஸ்பிட்டல் வந்துட்டாங்க. இங்கே வந்த உடனே எங்களோட டீம், எங்களோட சர்ஜிக்கல் டீம், எங்களோட எக்கோ டீம், நாங்கள்லாம் உட்காந்து பேசி நாங்கள் நினச்சோம் பாரு மசில் நல்லா தான் இருக்குது, ஆனால் ரொம்ப ஊதி போயிருக்கு, ஒரு வேளை இந்த மைட்ரல் லீக்கை நம்ம குறைச்சோம்னா அவர் கொஞ்சம் செட்டில் ஆகிடுவார், அப்போ ஹார்ட் டிரான்ஸ்பிளான்ட்டுக்காக வெயிட் பண்ணலான்னு நாங்கள் நினச்சோம். பட் நம்ம அவர் கொஞ்சம் கொஞ்சம் போக போக பார்த்தா அவரோட இம்ப்ரூவ்மெண்ட் அவ்வளோ நல்லா இருந்துச்சு. இப்போ பார்த்தீங்கன்னா நாங்கள் கிளிப்பு போட்டு 5 நாள் தான் ஆகும். இன்றைக்கி நடந்து வந்திருக்காரு உங்கள் மீட்டிங்க்கு. 90 நாள் ஐசியூஸில் இருந்துட்டு இன்றைக்கி உங்கள் மீட்டிங்கு நடந்து வந்திருக்காரு. அவரோட ஹார்ட் ஃபங்க்ஷன் 15லேருந்து 35 ஆயிடுச்சு. நல்ல இம்ப்ரூவ்மெண்ட் இருக்குது. இப்போ நான் கடவுளை என்ன வேண்டிக்கிறேன்னா இன்னும் ஒரு 3 monthஸில் அவருக்கு ஹார்ட் டிரான்ஸ்பிளான்ட்டே தேவைப்படக்கூடாதுன்னு வேண்டிக்கிறேன். ஈஸ்வரன்,
இந்த ட்ரீட்மெண்ட் வந்து ஃபஸ்ட் டைம் அப்போலோவில் பண்ணியிருக்கீங்க இல்லையா?
ஆமாம், ஃபஸ்ட் டைம் வந்து 2019 பண்ணோம். அதுக்கப்புறம் வந்து 3 வருஷமாக பண்ணிட்டு இருக்கோம். பட் ஆக்சுவலாக பார்த்தீங்கன்னா இந்த பேண்டமிக், இந்த கோவிடோட மோசமான மாதங்களில் இந்த லாஸ்ட் 4 monthஸில் மாதத்துக்கு 4 கேஸ் பண்ணியிருக்கோம். இந்த 4 கேஸில் மிஞ்சி போனால் நம்ம தமிழ்நாடுலேருந்து ஒரு கேஸ் தான், மிச்சம் 3 கேஸ் வந்து டெல்லியிலேருந்து, பூனேலேருந்து, ஆந்திராலேருந்து, இந்தியாவிலேருந்து எந்தெந்த ஸ்டேட் இருக்கோ அந்தந்த ஸ்டேட்லேருந்து மோஸ்ட்லி வந்து ரொம்ப சிக்காக ஆம்புலன்ஸ்லேயோ ஸ்பெஷல் ஃப்ளைட்லேயோ வந்திருக்காங்க. வந்து எல்லா பேஷண்ட்ஸ் நல்லா ட்ரீட்மெண்ட் எடுத்துகிட்டு வீட்டுக்கு போய் சேர்ந்துருக்காங்க. இது వరకు எல்லா పేషెంట్ நல்லா இருக்காங்க. ఈ అబ్బాయి పాపం ఒక పేద వ్యవసాయి, అతనికి జనవరిలో ఈ ఇయర్ హార్ట్ వచ్చి చాలా చెడిపోయింది, ఏం చేయని వాళ్ళు అని చెప్పారు. ఊరూరు తిరిగాడు, ఐసీయూలో ఉన్నాడు. ఆల్మోస్ట్ 3 months వచ్చి ఐసీయూలో ఉండేసి లాస్ట్లో చెప్పేసారు ఇంకేం చేయని వాళ్ళు, నీకు టైంకి హార్ట్ దొరికే మరి తెలియలేదు, బీపీ కూడా మంచి మెయింటైన్ చేయని వాళ్ళలేదు అని చెప్పే అవసరానికి అతను ఇక్కడ అపోలోలో వచ్చి చేరాడు. అపోలోలో వచ్చింది మేము అందరూ అతన్ని చూసి డెఫినెట్గా ఈ MitraClipతో అతనికి బెనిఫిట్ అవుతుంది అని అనుమానంతో మేము క్లిప్ చేశాము. మేము క్లిప్ చేసిన 2-3 రోజులనే అంత ఇంప్రూవ్మెంట్ ఉంది. 15% హార్ట్ ఫంక్షన్ ఇప్పుడు వచ్చి 35%కి వచ్చి MitraClip చేసి 5 రోజుల్లో అతను మీరే చూశారు. వీటికి నడిచి ప్రెస్ మీట్కి వచ్చి నెమ్మదిగా ఆక్సిజన్ లేకుండా మీతో అన్ని మాట్లాడి ఫోటోలు ఎత్తి ఇప్పుడు ఇంటికి వెళ్తున్నాడు నేటికి సాయంత్రం. నాకేమనుమానం అంటే ఒక 3 monthsలో చూస్తే హార్ట్ ఇంకా ఇంప్రూవ్ అయి ఉంటుంది, అతనికి ట్రాన్స్ప్లాంట్ అవసరం లేకుండా తప్పించుకుంటాడు నా అనుమానం. థ్యాంక్ యూ సార్.